Vikram, I think you are being live streamed now.
Oops. Okay. Hello and good evening, everyone. ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ನಾನು Dr. Vikram Jain from Optima Super Specialty Hospital, and we are back with our Facebook Live every month, which we do. We deal with very common topics of importance to the general public. ಸೊ ಇವತ್ತು ನಾವು ಮಾತಾಡೋದು ಟಾಪಿಕ್ ತುಂಬಾ ಕಾಮನ್. ಸೊ ಬೇರೆ ಬೇರೆ ಭಾಷೆಯಲ್ಲಿ ಡಿಫ್ರೆಂಟ್ ಹೆಸರು ಹೇಳ್ತೀವಿ. ಸೊ ತಲೆವಲಿ, ತಲೆನೊಪ್ಪಿ, ಸಿರ್ದರ್ದ್, headache. So our topic is headache, and I'm sure all of us have suffered from headache at some point of time in our life. We are varying from very mild to very severe headache. And so to learn more about the different types of headache and what is the management of headache, we have with us very eminent pain management specialist, Dr. Sutindra. Welcome, Dr. Sutindra.
Thank you. Thanks.
So we'll discuss with Dr. Sutindra broadly the different types of headache and their management. So let's just get into our topic quickly. Dr. Sutindra, can you just let us know what are the most common types of headache and facial pain which people suffer from?
Thank you, Dr. Vikram and Optima, for giving me this opportunity to interact with you all. As you rightly said, we are dealing with some forms of headaches and facial pains today. Coming to headaches, it is extremely common. I'm pretty sure there is not a single soul on the face of this earth who's not had a headache in their entire lives. But fortunately, more than 95% of them have self-limiting episodes which occasionally come and go, and it does not bother them in their quality of life. An unfortunate minority of people do have chronic debilitating headaches, which not only affects their quality of life, but also their work, professional and personal spheres of their life. It is in this minority of patients where specialist input is required to manage the pain. Coming to facial pains, the most common facial pain is the dental pain that you have. But as you would know, dental pain goes away once you visit the dentist and the root cause is eliminated. But as with headaches, there is also a minority of patients with whom there are other causes of facial pains like trigeminal neuralgia, atypical facial pain, temporomandibular joint pain. These can be very severe, debilitating, and pain managed well can change patients' lives.
Yeah. So thank you, Dr. Sutindra. I think what we don't realize that all headaches are not the same, and there's so many different structures. Body is there are so many different structures which can start the pain. Like Dr. Sutindra said, it could be the teeth, it could be the joint here, it could be inside the brain, it could be secondary causes. So varied causes, and the challenge is obviously to find out what is triggering these things. So one of the common things which people think when they think about headache is migraine. So for most people, headache means migraine. So what could be the common triggers for migraine, and can we just talk more about this migraine headache?
Yeah, migraine is extremely common. In medical terms, we say what is prevalence. Prevalence ಅಂದ್ರೆ 100 ಜನದಲ್ಲಿ ಆಲ್ಮೋಸ್ಟ್ 16 ಜನಕ್ಕೆ ಮೈಗ್ರೇನ್ ಇರೋ ಸಾಧ್ಯತೆ ಇದೆ. Migraine ಅನ್ನೋದು normally it comes on one side of the head. It can vary for the same person. On one day it can be on the right side of the head, on the other day on the left. But when it comes, it is normally on one side of the head. The common triggers, what are the things that start off a migraine attack can be anything, but most commonly is stress, alcohol, chocolates, skipping a meal, not drinking enough water, certain smells, sitting under a bright light. As such, it can be anything. But what is more important is for one particular patient to recognize what are his triggers and avoid the same.
Okay. So as we discussed, migraine can be due to a lot of triggers, but how does this stress? So obviously we are living in an era where everybody is under some sort of stress. So most of us have neck pain, back pain, stress, the lifestyle. But how does this lead to headaches, facial pains? Can you just elaborate on that?
Yeah, you see, it is nowhere is it proven that stress and a bad lifestyle causes headache. But what we can say for sure is that stress and lifestyle factors like not eating well, not having a well disciplined time schedule, not sleeping well, skipping meals, not drinking enough water, all of these help in maintaining the headache, increasing the severity, increasing the frequency of attacks. So how does this work is all these headaches are an interplay between neurological, vascular, and chemical factors. And the stress or the lifestyle factors can exacerbate how these cause pain. Although stress per se and the lifestyle issues per se will not cause pain, but it definitely causes an increase in the intensity, increase in the frequency, and thus suffering of the person.
Okay, so on the background of disease, these are probably something which exacerbate or ಜಾಸ್ತಿ ಮಾಡುತ್ತೆ ಅದನ್ನ pain.
Absolutely.
ಸೊ ಯಾ ಸೊ ನಾವು ಮಾತಾಡಿದ್ವಿ ಬೇರೆ ಬೇರೆ ಹಲವಾರು ಕಾರಣಗಳು ಹೆಡ್ಏಕ್. ಸೊ ಬೇರೆ ಬೇರೆ ಪೇನ್ ಕಾಸಿಂಗ್ ಏರಿಯಾಸ್, ಟೂತ್ ಅಲ್ಲಿ, TMJ ಜಾಯಿಂಟ್ ಅಲ್ಲಿ, or ಸರ್ವೈಕಲ್ ನೆಕ್ ಅಲ್ಲಿ. ಬಟ್ how do you go about diagnosing the cause of somebody has headache for a long period of time? ಬಹಳ ತಿಂಗಳಿಂದ ವರ್ಷಗಳಿಂದ ನೋವಿದೆ, ತಲೆನೋವಿದೆ ಅಥವಾ ಫೇಸಲ್ ಪೇನ್ ಇದೆ. How do you go about trying to try to analyze and diagnose what is could be the cause of this pain? Because for a layman, everything is probably they say, okay, this migraine, or this is stress, so I didn't sleep, so, or sinusitis. So how do you go about diagnosing, or how does a doctor go about diagnosing these cases?
Yeah, the issue with the headache is that it is so common. It is so easy to go overboard and order a lot of investigations. But it is also we should refrain from not investigating and missing something important. In this aspect, although this might sound a little bit medical, but it is important for people to understand this main two types of headache. One is the primary headache, the other thing is called secondary headache. Primary headache is the most common. Primary ಅಂದ್ರೆ ಏನು ಅಂದ್ರೆ there is no underlying organic cause. ಅಂದ್ರೆ ಒಂದು CT ಸ್ಕ್ಯಾನ್ ಮಾಡಿದ್ರೆ ಅಥವಾ MRI ಮಾಡಿದ್ರೆ ಅಥವಾ ಒಂದು ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಮಾಡಿದ್ರೆ ಏನು ಸಿಗಲ್ಲ. That is primary headache. Whereas secondary headache is the headache due to another cause, like I mean, this is not common, but you must know some clot in the brain or some infection in the brain, some cyst in the brain or a small tumor in the brain. These are the secondary headaches. Once the main reason of getting an MRI or a CT or a blood test in a person who has chronic headache, that is headache more than 3 months, is to rule out a secondary cause. Because once the secondary cause ಏನು ಇಲ್ಲ ಅಂತ ಗೊತ್ತಾಗ್ಬಿಟ್ರೆ, then we can treat the pain as it is. And ನೀವು ಹೇಳ್ದಂಗೆ there are at least 100 types of primary headache, more than 100 items. Most common is tension headache, migraines, cluster headache. There are so many of these, and all these are clinical diagnosis. Clinical diagnosis ಅಂದ್ರೆ ಪೇಷಂಟ್ ಅವರ ರೋಗ ಲಕ್ಷಣನ ಹೇಳೋದನ್ನ ನಾವು ಅನಲೈಸ್ ಮಾಡಿ ಈ ತರ ಮೈಗ್ರೇನ್ ಇರ್ಬೋದು ಅಥವಾ ಈ ತರ ಟೆನ್ಷನ್ ಹೆಡ್ಡೇಕ್ ಇರ್ಬೋದು, ಈ ತರ ಕ್ಲಸ್ಟರ್ ಹೆಡ್ಡೇಕ್ ಇರ್ಬೋದು ಅಂತ ಡಯಾಗ್ನೋಸ್ ಮಾಡೋದು. ಸೊ ಇಟ್ ಈಸ್ ಇಂಪಾರ್ಟೆಂಟ್ ಟು ಡಯಾಗ್ನೋಸ್ ದ ರೈಟ್ ಟೈಪ್ ಆಫ್ ಹೆಡ್ಡೇಕ್. ಬಿಕಾಸ್ ನಿಮ್ಗೆ ಗೊತ್ತಾಗಿರೋಂಗೆ ಈಗ ಎಲ್ಲಾರ್ಗೂ ಒಂದೇ ತರ ಶರ್ಟ್ ಹೊಲಿಯಕ್ಕಾಗಲ್ವಲ್ಲ, ಒಬ್ಬೊಬ್ರಿಗೆ ಒಂದೊಂದು ಸೈಜ್ ಇರುತ್ತೆ. ಸೊ ಒಂದೊಂದು ತಲೆನೋವಿಗೆ ಒಂದೊಂದು ತರ ಟ್ರೀಟ್ಮೆಂಟ್. ನಾವು ಡಯಾಗ್ನೋಸೇ ಮಾಡಕ್ಕಾಗ್ಲಿಲ್ಲ ಅಂದ್ರೆ ನಮ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಬ್ವಿಯಸ್ಲಿ ವರ್ಕ್ ಆಗಲ್ಲ. ಸೊ ಬಹಳ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗುತ್ತೆ ಟು ಡಯಾಗ್ನೋಸ್ ದ ರೈಟ್ ಟೈಪ್ ಆಫ್ ಹೆಡೇಕ್ ಅಂಡ್ ಆಲ್ಸೋ ಟು ರೂಲ್ ಔಟ್ ಎನಿಥಿಂಗ್ ಡೇಂಜರಸ್.
Yes, very important point, Dr. Srinath. Two important what I could take away is one is diagnosis correct ಆಯ್ತು ಅಂದ್ರೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಅಷ್ಟೇ ಪರ್ಫೆಕ್ಟ್ ಆಗಿ ಮಾಡಬಹುದು. And unnecessary anxiety and stress obviously is relieved from that. So and also we can be very efficient in what testing we do and be very clear about what is the treatment goals. So we talked about diagnosing the primary and secondary headaches, where secondary could be due to some tumor or infection, or but most people that is where they are worried about. So
Absolutely.
yeah, what are the treatment? So first, let's start with the primary headache. What are the current treatment options, different treatment modalities for managing primary headaches?
Yeah, ಅಂದ್ರೆ all these primary headaches ನ we cannot treat with one modality. ಅಂದ್ರೆ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಮಾತ್ರೆಗಳು, ಬರೀ ಮಾತ್ರೆ ತಗೊಂಡ್ರೆ ನೋವನ್ನ ಕಂಟ್ರೋಲ್ ಆಗಲ್ಲ. ದಟ್ ಈಸ್ ನಾಟ್ ದ ರೈಟ್ ವೇ ಆಫ್ ಡೂಯಿಂಗ್ ಇಟ್. ಸೊ ಇದನ್ನ ನಮ್ಮ ಮೆಡಿಕಲ್ ಭಾಷೆಯಲ್ಲಿ ಮಲ್ಟಿ ಮೋಡಲ್ ಅಂಡ್ ಮಲ್ಟಿ ಡಿಸಿಪ್ಲಿನರಿ ಅಪ್ರೋಚ್ ಅಂತೀವಿ. ಅಂದ್ರೆ ಮಲ್ಟಿ ಮೋಡಲ್ ಅಂದ್ರೆ ಯಾವುದೇ ಬರೀ ಮೆಡಿಕೇಶನ್ಸ್ ಆಗ್ಲಿ, ಬರೀ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜಸ್ ಆಗ್ಲಿ, ಯಾವುದು ವರ್ಕ್ ಆಗಲ್ಲ. ಎಲ್ಲಾರನ್ನು ಹೋಲಿಸ್ಟಿಕ್ ಆಗಿ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ನಾವು ಒಂದೊಂದಾಗಿ ಹೇಳ್ತಾ ಹೋಗ್ತೀನಿ. ಸಮ್ ಆಫ್ ದ ಆಪ್ಷನ್ಸ್ ದಟ್ ವಿ ಕಂಬೈನ್. ಮೋಸ್ಟ್ ಕಾಮನ್ಲಿ ಎಲ್ಲಾ ಪೇಷಂಟ್ಸ್ ಫಸ್ಟ್ ಕೇಳೋದೇ ನಮ್ಗೆ ಯಾರು ಮಾತ್ರೆ ಕೊಟ್ಬಿಡಿ ಅಂತ. ಸೊ ವಿಲ್ ಸ್ಟಾರ್ಟ್ ಫ್ರಮ್ ದ ಮೆಡಿಕೇಶನ್ಸ್ ಇಟ್ ಸೆಲ್ಫ್. ಸೊ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಇಫ್ ಯು ಟೇಕ್ ಮೈಗ್ರೇನ್, ಮೆಡಿಕೇಶನ್ಸ್ ಎರಡ್ ತರ ಬರುತ್ತೆ. ಒಂದು ಪ್ರೊಫೈಲಾಕ್ಟಿಕ್ ಥೆರಪಿ ಅಂತೀವಿ, ಇನ್ನೊಂದು ಅಬಾರ್ಟಿವ್ ಥೆರಪಿ ಅಂತೀವಿ. ಅಬಾರ್ಟಿವ್ ಥೆರಪಿ ಅಂದ್ರೆ ತಲೆನೋವು ಬಂದಾಗ ಮಾತ್ರ ಮಾತ್ರೆ ತಗೊಳ್ಳೋದು. ಪ್ರೊಫೈಲಾಕ್ಟಿಕ್ ಥೆರಪಿ ಅಂದ್ರೆ ದಿನಾಗ್ಲೂ ಮಾತ್ರೆ ತಗೊಳ್ಳೋದು, ಸೊ ದಟ್ ತಲೆನೋವು ಬರದೇ ಇರೋದಕ್ಕೆ. ಇದು ಯಾರಿಗೆ ಯಾವುದು ಅನ್ನೋದು ಪೇಷಂಟ್ಗೆ ಎಷ್ಟು ಸಿವಿಯಾರಿಟಿ ಇದೆ, ಎಷ್ಟು ಫ್ರೀಕ್ವೆಂಟ್ ಆಗಿದೆ, ಎಷ್ಟು ಪದೇ ಪದೇ ಬರ್ತಾ ಇದೆ ಅನ್ನೋದ್ರ ಮೇಲೆ ನಾವು ಡಿಸೈಡ್ ಮಾಡ್ತೀವಿ ಕ್ಲಿನಿಕ್ ಅಲ್ಲಿ ಎಕ್ಸಾಮಿನ್ ಮಾಡಿ. ಸೊ ಅದು ಮೆಡಿಕೇಶನ್ಸ್, ಅದನ್ನ ಕಟ್ನಿಟ್ಟಾಗಿ ಸ್ವಲ್ಪ ಫಾಲೋ ಮಾಡ್ಬೇಕಾಗತ್ತೆ ಒಂದು. ಇನ್ನೊಂದು, ಇಷ್ಟೊತ್ತು ನಾವು ಮಾತಾಡೋದಲ್ಲ, ಈಗ ಬಸ್ ವರ್ಡ್ ಆಗ್ಬಿಟ್ಟಿದೆ ಎಲ್ಲಾ ಡಿಸೀಸಸ್ ಅಲ್ಲೂ ಲೈಫ್ ಸ್ಟೈಲ್. ಹೇಳೋದು ಈಸಿ, ಆದ್ರೆ ಪಾಟ್ಸೋದು ಕಷ್ಟ. ನಿದ್ದೆ ಮಾಡ್ಬೇಕು 6 ರಿಂದ 8 ಗಂಟೆ ಕಾಲ, ಟೈಮ್ ಸರಿಯಾಗಿ ಊಟ ಮಾಡ್ಬೇಕು, ಚೆನ್ನಾಗಿ ನೀರ್ ಕುಡಿಬೇಕು, ಅಂಡ್ ಟ್ರಿಗರ್ಸ್ ಅವಾಯ್ಡ್ ಮಾಡ್ಬೇಕು. ನಮಗೆ ಹೋಗ್ತಾ ಹೋಗ್ತಾ ಗೊತ್ತಾಗುತ್ತೆ, ನನಗೆ 1 ಗಂಟೆ ಒಳಗಡೆ ಊಟ ಮಾಡ್ಲಿಲ್ಲ ಅಂದ್ರೆ ತಲೆನೋವು ಬರುತ್ತೆ ಅಂದ್ರೆ ಸ್ವಲ್ಪ ಅದನ್ನ ಕೇರ್ ತಗೊಂಡು ಊಟ ಮಾಡ್ಕೋಬೇಕು. ಅಂಡ್ ಒಂದಿಷ್ಟು ಊಟಗಳು ತಿಂದ್ರೆ ನನಗೆ ಆಗಲ್ಲ ಅಂದ್ರೆ ಅದನ್ನ ನೋಡ್ಕೋಬೇಕು. ಅಂಡ್ ವಿ ಆಲ್ಸೋ ರೆಕಮೆಂಡ್ ಎ ಲಾಟ್ ಆಫ್ ಮೈಂಡ್ ಬಾಡಿ ಅಪ್ರೋಚಸ್. ಅಂದ್ರೆ ಬೋತ್ ಫಿಸಿಕಲ್ ಎಕ್ಸರ್ಸೈಸಸ್ ಲೈಕ್ ಯೋಗ ಅಥವಾ ಏರೋಬಿಕ್ ಎಕ್ಸರ್ಸೈಸಸ್, ಪಿಲಾಟೆಸ್, ಅಂಡ್ ಮೈಂಡ್ ಅಪ್ರೋಚಸ್ ಲೈಕ್ ಮೆಡಿಟೇಷನ್, ಧ್ಯಾನ, ಪ್ರಾಣಾಯಾಮ. ಆಲ್ ದೀಸ್ ಆಲ್ಸೋ ಹೆಲ್ಪ್. ಅಂಡ್ ಸಮ್ ಪೀಪಲ್ ಆಲ್ಸೋ ವಿ ರೆಫರ್ ಟು ಸೈಕಾಲಜಿಸ್ಟ್. ಏನಪ್ಪಾ ಇವ್ರು ನನ್ನ ಸೈಕಾಲಜಿಸ್ಟ್ ಕಳಿಸ್ತಾ ಇದಾರೆ, ನಾನೇನ್ ಸುಳ್ಳು ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂತ ಹಂಗಲ್ಲ. ಬಟ್ ಎಷ್ಟೊಂದ್ ಸತಿ ನೋವನ್ನ ತಡ್ಕೊಂಡು ನೋವು ಜೊತೆ ನಾವು ಬಾಳಕ್ಕೆ ಒಂದಿಷ್ಟು ನಮಗೆ ಸ್ಕಿಲ್ಸ್ ಬೇಕಾಗುತ್ತೆ. ಹೇಗೆ ನಾವು ನೋವು ಬಗ್ಗೆ ಯೋಚನೆ ಮಾಡ್ತೀವಿ, ಯಾವ್ದು ಒಳ್ಳೆ ಯೋಚನೆಗಳು, ಯಾವ್ದು ಕೆಟ್ಟ ಯೋಚನೆಗಳನ್ನ ಪಕ್ಕಕ್ಕಿಟ್ಟು ಪಾಸಿಟಿವ್ ಯೋಚನೆಗಳು ಹೇಗ್ ಮಾಡೋದು, ಅದಕ್ಕೆಲ್ಲ ಸ್ವಲ್ಪ ಸೈಕ್ಯಾಟ್ರಿ ಅಲ್ಲ, ಸೈಕಾಲಜಿ ಹೆಲ್ಪ್ ಬೇಕಾಗ್ಬೋದು. ಇದರ ಜೊತೆ ಟೈಮ್ಸ್ ಫಾರ್ ಎಲಿಜಿಬಲ್ ಪೇಷಂಟ್ಸ್ ವಿ ಡೂ ವಾಟ್ ಆರ್ ಕಾಲ್ಡ್ ಅಸ್ ಬೋಟಾಕ್ಸ್ ಇಂಜೆಕ್ಷನ್ಸ್. ಅಂದ್ರೆ ಇಂಟರ್ವೆನ್ಷನಲ್ ಪೇನ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಂತಾರಲ್ವ. ಬೋಟಾಕ್ಸ್ ಅನ್ನೋದು ಈ ಮುಂಚೆ ಎಷ್ಟೊಂದ್ ಜನ ಈ ರಿಂಕಲ್ಸ್ ನೆಲ್ಲ ತೆಗಿಯಕ್ಕೆ ಇಂಜೆಕ್ಟ್ ಮಾಡ್ಕೊಂತಾರಲ್ಲ ಅದು. ಸೊ ಕ್ರಾನಿಕ್ ಮೈಗ್ರೇನ್ಸ್ ಅಲ್ಲಿ ಎವ್ರಿ 3 months ಬೋಟಾಕ್ಸ್ ಇಂಜೆಕ್ಷನ್ಸ್ ಕೊಟ್ರೆ ಇಟ್ ಹ್ಯಾಸ್ ಗುಡ್ ರಿಲೀಫ್ ಅಂಡ್ ರಿಡ್ಯೂಸಸ್ ದ ಅಮೌಂಟ್ ಆಫ್ ಮೆಡಿಕೇಶನ್ ದ ಪೇಷಂಟ್ ನೀಡ್ಸ್. ಎಷ್ಟು ಟ್ಯಾಬ್ಲೆಟ್ ತಗೋದು ಕಡಿಮೆ ಆಗುತ್ತೆ ಒಂದು. ಇನ್ನೊಂದು, ಎಷ್ಟೊಂದ್ ಸತಿ ಗೆ ಸರ್ವೈಕೋಜೆನಿಕ್ ಹೆಡೇಕ್ ಅಂತ ಬರುತ್ತೆ. ಅಂದ್ರೆ ನೆಕ್ ಅಲ್ಲಿ ಅಪ್ಪರ್ ಪಾರ್ಟ್ ಅಲ್ಲಿ ಇರೋ ಜಾಯಿಂಟ್ ಸ್ವಲ್ಪ ಆರ್ಥರೈಟಿಸ್ ಆದಾಗ ಹಿಂಗ್ ಅಲ್ಲಿಂದ ತಲೆನೋವು ಬರುತ್ತೆ. ಆ ಜಾಯಿಂಟ್ಸ್ ಗೆ ಸ್ಟಿರಾಯ್ಡ್ ಇಂಜೆಕ್ಷನ್ಸ್, ರೇಡಿಯೋ ಫ್ರೀಕ್ವೆನ್ಸಿ ಡಿನರ್ವೇಷನ್ ಅಂತಾನು ಮಾಡ್ತೀವಿ. ಸೊ ಇದನ್ನ ಟೈಲರ್ಡ್ ಅಪ್ರೋಚ್ ಅಂತೀವಿ. ಅಂದ್ರೆ ಪೇಷಂಟ್ ನ ಕ್ಲಿನಿಕಲ್ ನೋಡಿ ಅವ್ರದ್ದು ಎಷ್ಟು ಸಿವಿಯರ್ ಇದೆ, ಎಷ್ಟು ಅವ್ರ ಲೈಫ್ ಅಲ್ಲಿ ಇಂಟರ್ಫಿಯರ್ ಆಗ್ತಾ ಇದೆ, ಅದನ್ನೆಲ್ಲ ನೋಡಿ ಯಾವ್ದು ಬೇಕು ಪೇಷಂಟ್ಸ್ ಜೊತೆ ಆಪ್ಷನ್ಸ್ ಡಿಸ್ಕಸ್ ಮಾಡಿ ವಿ ಆಫರ್ ದೆಮ್ ರೇಂಜ್ ಆಫ್ ಆಪ್ಷನ್ಸ್.
Yeah, interesting, very interesting, Dr. Sunindra, about this Botox injection. How does this work? How does Botox? It's like Botox is, as you said, the skin wrinkles not tagi, but how does that help headache?
Yeah. ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ there is one concept called peripheral sensitization. ಅಂದ್ರೆ ಆಲ್ದೋ ಮೈಗ್ರೇನ್ ನಮಗೆ ತಲೆ ಒಳಗಡೆ ಅನ್ಸಿದ್ರು, the sensations from here can trigger migraine. ಅಂಡ್ ವೆನ್ ಯು ನೋ ನರ್ವ್ಸ್, ಒಂದು ನರ್ವ್ ಇನ್ನೊಂದು ನರ್ವ್ ಮಾತಾಡೋದು ಕೆಮಿಕಲ್ಸ್ ಮೂಲಕ. ಇದು ಒಂದು ಕೆಮಿಕಲ್ ನ ಎಮಿಟ್ ಮಾಡುತ್ತೆ, ಅದನ್ನ ಕ್ಯಾಪ್ಚರ್ ಮಾಡುತ್ತೆ ಇನ್ನೊಂದು ನರ್ವ್. ಸೊ ಈ ಬೋಟಾಕ್ಸ್ ಇಂಜೆಕ್ಷನ್ಸ್ ಅದು ಎರಡರಲ್ಲಿರೋ ಮಧ್ಯದಲ್ಲಿರೋ ನ್ಯೂರೋ ಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್, ಆ ಕೆಮಿಕಲ್ಸ್ ನ ಎಕ್ಸೈಟ್ ಮಾಡೋ ಕೆಮಿಕಲ್ಸ್, ನೋವು ಮಾಡೋ ಕೆಮಿಕಲ್ಸ್ ನ ಸಮಥಿಂಗ್, ಒನ್ ಆಫ್ ದ ಮೋಸ್ಟ್ ಕಾಮನ್ ಕೆಮಿಕಲ್ಸ್ ಇಸ್ ಕಾಲ್ಡ್ ಸಬ್ಸ್ಟೆನ್ಸ್ ಪಿ ಅಂತ. ಅದನ್ನ ಇನ್ಹಿಬಿಟ್ ಮಾಡಿದಾಗ ಪೇನ್ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಅಂಡ್ ಒಂದು ಬೋಟಾಕ್ಸ್ ಸೆಷನ್ 3 months ತನಕ ಎಫೆಕ್ಟಿವ್ ಆಗಿರುತ್ತೆ. ಸೊ ಸ್ಲೋಲಿ ನೋವು ಬಂದಂಗೆ ಇನ್ನೊಂದ್ಸತಿ ಮಾಡಿಸ್ಕೋಬಹುದು. ಪೂರ್ತಿ 100ಕ್ಕೆ 100 ಕಡಿಮೆ ಆಗ್ಬಿಡುತ್ತೆ ಅಂತಲ್ಲ. ಅಂಡ್ ನಾವ್ ಇದನ್ನ ಎಲ್ಲಾ ಪೇಷಂಟ್ಗೂ ಮಾಡಲ್ಲ. ಎಲ್ಲಾ ಪೇಷಂಟ್ಗೂ ಮಾಮೂಲಾಗಿ ಮೆಡಿಕೇಶನ್ಸ್ ಕೊಡೋದು. ಯಾವ ಪೇಷಂಟ್ಸ್ಗೆ ಒಂದು ಮೆಡಿಕೇಶನ್ಸ್ ಇಂದ ಉಪಯೋಗ ಆಗ್ತಾ ಇಲ್ಲ ಅಥವಾ ಮೆಡಿಕೇಶನ್ಸ್ ಇಂದ ಉಪಯೋಗ ಆಗ್ತಾ ಇದೆ, ತುಂಬಾ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಇದೆ, ಅಂತವ್ರಿಗೆ ಈ ಬೋಟಾಕ್ಸ್ ಇಂದ ಸ್ವಲ್ಪ ದ ಅಮೌಂಟ್ ಆಫ್ ಮೆಡಿಕೇಶನ್ ಲೋಡ್, ಅಂದ್ರೆ ಎಷ್ಟು ಮೆಡಿಕೇಶನ್ ತಗೋಬೇಕು, ಕಡಿಮೆ ಆಗುತ್ತೆ.
Very, very interesting. Are there any other Vasa therapy ಅಥವಾ emerging therapies ಈ ತರ facial pain, headaches apart from Botox?
Yeah. So all this while we spoke about headaches. there are only a few headaches which are amenable to what we call as interventional pain management. ಅಂದರೆ injections, nerve blocks ಕೊಟ್ಟು ಮಾಡೋದು. One thing I spoke about Botox, other was this cervical facet joint denervation. ಅಂದರೆ small nerves that supply the joint ನ special needles ಹಾಕಿ 80 degrees ತನಕ heat ಮಾಡಿದ್ರೆ they can get good relief. The other type of facial pain is called trigeminal neuralgia. This is one of the worst pains known to mankind. ವೇರ್ ಮುಖದಲ್ಲಿ ದವಡೆ ಹತ್ರ ಅಥವಾ ಈ ಭಾಗದಲ್ಲಿ ಅಥವಾ ಕಣ್ಣ ಮೇಲೆ ಒಂದು ಎಲೆಕ್ಟ್ರಿಕ್ ಶಾಕ್ ಹೊಡೆದಂಗೆ ಆಗುತ್ತೆ ಅವ್ರಿಗೆ. ಅನ್ಫಾರ್ಚುನೇಟ್ಲಿ ಮೋಸ್ಟ್ ಆಫ್ ದೆಮ್ ಗೋ ಟು ಎ ಡೆಂಟಿಸ್ಟ್ ಫಸ್ಟ್ ಥಿಂಕಿಂಗ್ ಆಫ್ ಇಟ್ ಆಸ್ ಎ ಟೂತ್ ಪ್ರಾಬ್ಲಮ್. Only after getting 2 or 3 tooth removed, then they realize that it is a facial pain. And the problem is a small blood vessel touching the nerve near the brain. There are multiple therapies for it as medications irbodu, surgery irbodu. One new thing that has come is called as radio frequency denervation, where on ಸಣ್ಣ ನೀಡ್ಲ್ ಹಾಕಿ ಆ ನರನ್ನ ಮತ್ತೆ 80 ಡಿಗ್ರೀಸ್ ತನಕ ಹೀಟ್ ಮಾಡಿದ್ರೆ ಆಲ್ಮೋಸ್ಟ್ 5 years ತನಕ ಪೇನ್ ರಿಲೀಫ್ ಆಗುತ್ತೆ. ಆಪರೇಷನ್ ಏನು ಇಲ್ಲ, ಜಸ್ಟ್ half a day to 1 day admission ಅಲ್ಲಿ patients get very good relief. Honestly, in my practice, this is one of the most satisfying procedures I do, because the pain relief is so instant and dramatic that ವರ್ಷಾನುಗಟ್ಲೆಯಿಂದ ಒದ್ದಾಡ್ತಾ ಇರೋ patient in an instant they get better, especially with this particular procedure.
Wow, that's really interesting and really good to know that we can offer patients these sort of newer therapies. Dr. Sundara, in your practice, can you share any anecdote, any patient which you probably had very interesting or rare cause of headache which you found, and any treatment, something which you would like to share with our audience?
Yeah, I mean, as I told you, trigeminal neuralgia patients have always been very satisfying. But a few months back, I had one 60-year-old gentleman who had this severe trigeminal neuralgia, and he had stopped eating since the past few months. And let alone eating, he would not even brush his teeth for the fear of pain. And we can only, it's okay if we don't eat, we are the ones who are hungry. But imagine not being able to brush your teeth and the social stigma it creates in not only in your place, but also wherever you go. And fortunately, he sort of went around and landed up with us, and we did a radio frequency denervation, and in an instant, his pain had gone. So as soon as the surgery was over, the first thing he did was not eat. He first went up and brushed his teeth for half an hour and told, "Now I'm a normal human being who can sort of interact with other people."
That must be very gratifying.
Very gratifying.
It changed life in a big way, and how pain can affect us in major ways.
Yes.
That just goes to demonstrate. So just coming back, how do patients manage their headaches or facial pain on a daily basis? What advice would you give to patients who have headaches or long-term chronic headaches?
See, basically, it is not an easy one. Let's be honest. Having a chronic headache is not an easy thing. But the first thing is to accept that we have a problem and get appropriate medical advice with an expert and follow the medications. And that's why in our practice, education is a big factor in patient consultation. We educate the patients as to what is the cause of pain, what is the natural history, and what are the goals of our treatment. I mean, let us be honest, in most headache patients, we will never be able to treat them. We can only manage them, just like we manage diabetes and hypertension. We just have to manage with medication. So sticking to your medication and as suggested, medication, even if the medications give 30, 40, 50% relief, the patient can themselves add 10, 20% more by getting on the lifestyle side of things, the pranayama, meditation stuff. And also we encourage patients to maintain their headache diaries, so that when they come back to the follow-up, it becomes easier as to gauge if our treatment is helping or not. Otherwise, vague answers like I'm better, maybe 10% better. What we need to know is the severity and the intensity, the frequency, has it decreased? So these are the sort of things that we tell them. We also tell them, yes, see, you have a problem, so you have to change your life around it. You have to pace yourselves. Maybe there are things that you cannot do just like anyone else. Rather than cribbing about it, accept it and try to move on along with your pain problem.
Yes, I think you hit the nail on the head. Very important is first accept that you have a problem and then try to find a solution and try to find a way to work, whether it be medical, whether it could be non medication wise, lifestyle or other changes. But most important thing, what if anybody has to take away is not all headaches are the same. Headaches can be due to various causes. The management can differ from widely. So it's important that you meet the doctor and get yourself evaluated and try to find the cause, because if you find the cause, obviously the treatment can be more perfect and the results are going to be better. So yeah, we discuss about these things about lifestyle changes, how important is simple things like diet, hydration in managing headaches.
See, the good thing with these lifestyle changes is you can not only manage headaches but also other things as well. If you're a diabetic, your diabetes will be under control. If you're hypertension, if your hypertension will be control. So it is extremely important. Pain management is not just pill popping, isn't it? The pills, the medications are only a one small aspect of the pain where it is very passive. We prescribe, the patient buys and takes it. The active participation comes in this part of the things where lifestyle, diet, not only timely diet but also the right diet, avoiding junk food, and in headaches in particular, being a little bit attentive to the triggers, the food triggers, and trying to avoid them. It is very difficult to predict what triggers migraine in any one person, only they know it. And staying well hydrated, carrying a bottle of water, and eating well, sleeping well on time. I think it might sound old fashioned, but that is the right way.
Yeah, exactly. I mean, it's so interesting. Ella common chronic diseases, when we say eat well, sleep well, do regular exercise, avoid stress, do some mindfulness meditation. So I think most of the things, the changes which we advise, which is difficult in this day and age, but that is the simple things, which is have food on time, have adequate, stay hydrated, make sure you get 7 8 hours of sleep, make sure you do at least half an hour of exercise every day. I think this should be the mantra for all of us, to make sure that we are able to manage the chronic conditions. You talked about a very satisfying or gratifying the patient where you were able to do a radio frequency ablation or trigeminal neuralgia worsened. Are there other like very challenging cases also where very difficult to? Have you had any sort of patient whom it was very difficult to find out and maybe sometimes not find out also? So are there such patients?
Yeah, there have been many. See, in headaches, many a time, actually diagnosis is one of the easiest. Then what happens is, what do you do with the diagnosis? For example, we had a young 27, 28-year-old lady a few months back who's been suffering from migraine for long. Uh, and it's not that we are the only one who treat migraine, isn't it? She's been to multiple places. She is still struggling, and the migraine thing has gone to such a level that she was experiencing difficulties both in her professional life. She had quit her job, and this pain was interfering with her personal life as well, also on the verge of divorce. So that's when she came to us. I mean, as usual, we did work her up and put her on all the medications initially. We went through the course of the routine, first line, second line, third line. We even did Botox, but somehow she was not very happy. We pulled in a psychologist, psychiatrist, everything. But at the end of the day, she still continued to have pain. But the only solace was that we could sort of, I mean, I don't know, we could sort of save her marriage, but she's still suffering from pain and is not able to work. So sometimes these things happen because there are layers which we don't understand. But in spite of that, what we can sort of offer our patients is not cure for everyone, but maybe care for everyone.
Exactly. I mean, there is still on the reasons there. Medical science still has to lot to learn and understand, and we are getting better at it compared to, I'm sure, compared to what we were able to do 20 years back. Now we are much better. We're able to diagnose many things much better and treat them much better. But there's still, despite all the advancements, still we need to learn a lot. And think I'm sure with time, we'll be in a better place. Maybe 5 years, 10 years down the lane, where we will to manage them better. Um, I'm sure you see a lot of patients with facial pain, headaches. What are the most common FAQs or frequently asked questions you receive? when patients come to you? What is there, they would definitely say, can I do this? Can I do that? What is the most common things you get asked about headaches?
I think the top two will be is first, do I have a brain tumor?
Yes,
And
definitely.
once we sort of explain them, get the necessary radiology investigations to reassure them, at the end of the consultation, the most common question asked is, should I live with this for the entire of my life?
Mm,
So, I mean, both are right questions. The first question, as long as we are able to sort of assure them with the appropriate investigation that there is nothingly sort of organically wrong, that is the easier question. But this question of should I live with this for my entire of my life is a sort of tricky question to answer, because the moment you say yes, they get disappointed. The moment you can't say no, because that would amount to lying. So we have to say, tell them that yes and no is the right answer. You have to live with the pain, but the pain won't be severe as long as the pain is not affecting your daily life. It is something that is very, very manageable.
yes, wonderful. I mean, most chronic conditions can be managed very well. Whether we are able to completely eradicate, obviously, it depends on a lot of factors. And I think severity also varies from patient to patient, and the amount of response to medication, that all decides, a lot of factors decide who gets how much relief and for how long. Um, if somebody needs or seeks more information, is experiencing a lot of headaches and facial pains, how can they get more information? Where do they seek help? Whom do they approach?
I mean, headache, everybody treats headache, from general physicians to neurologists to pain physicians, everybody of that sort. There's a lot of resources on the internet which give a lot of information about it. Personally, from my thing, I'm available at Optima Hospital all days, 4:30 to 5:30, only on appointment basis. Over and above that, if you have any questions, you can leave them on our Facebook place. I'll be glad to answer.
Wonderful. Uh, there have been a few questions which we can take. Um, One question is, what are the diet plans to reduce facial pain? Are there any diet plans to reduce facial pain?
Uh, no, as such, no. There are a lot of food fads surrounding migraine. None of these have been proven. As I said, the only thing that you need to sort of follow is a balanced, healthy, timely diet. Importantly, recognize what are your triggers and try to avoid them. There is no diet as such that has been recommended for migraine.
Okay. Um, Mr. Vikas has said, does the pain follow a particular pattern or occur at specific times? I think he means migraine sort of headaches.
Yeah, a migraine sometimes can be seasonal, but there's another headache called cluster headache, which is extremely seasonal. It's also called alarm headache, where it comes in specific months of the year and also during specific times of the day. So that is one headache which is very, very seasonal and specific. Migraine, yes, it can be seasonal, but more often than not, it is sort of it can be difficult to predict.
Hmm. So, when should a patient uh, come to a doctor? We discussed probably part of it. Uh, when should for first headache, should he go to a doctor? Or if it's a very severe headache, he should go to a doctor. Or if it's not relieving, should he try some over the counter, some paracetamol, and see when do he or she decide that, yeah, it's time to see a doctor. I need to get this checked out. What could be the red flags, the danger signs, which is in, yeah.
Yeah. See, when we mean red flags, we mean the secondary headaches, isn't it? As I told
Mm,
you, the initial part of thing, is there an underlying cause that is causing headaches? For example, is there something in the brain? So what happens is pain in the night, pain that wakes you up suddenly in the night, what is called as a thunderclap headache, uncontrolled hypertension, any other neurological symptoms. Neurological symptoms ಅಂದ್ರೆ ಕಣ್ಣು ಮಂಜಾಗೋದು, ಕಣ್ಣು ಸುತ್ತೋದು, ಕೈ ಕಾಲಲ್ಲಿ ವೀಕ್ನೆಸ್, ಕೈ ಕಾಲು ಜೋಮು, any fever, any weight loss associated with the headaches, any bowel and bladder ಅಂದ್ರೆ urine motion ಏನಾದ್ರು problem. All these are red flags for headaches. But not only these, any chronic headache, if you've been suffering for more than 3 months, it's better to see a specialist, because there's another headache called medication overuse headache, because in migraine for especially ಮಾತಾಡ್ತಾ ಇದ್ವಲ್ಲ ಇಷ್ಟೊತ್ತು ಅಬಾರ್ಟಿವ್ ಥೆರಪಿ ಅಂದ್ರೆ ತಲೆನೋವು ಬಂದಾಗ ಮಾತ್ರೆ ತಗೊಳ್ಳೋದು. Evidence says that if you take it for more than 8 times in a day, I mean 8 times in a month, sorry, ಅಂದ್ರೆ ವಾರಕ್ಕೆ 2 ಸತಿಕ್ಕಿಂತ ನೀವು ಜಾಸ್ತಿ ತಲೆನೋವಿಗೆ ಮಾತ್ರೆ ತಗೊಂಡ್ರೆ you will get another headache called medication overuse headache. So that is when the doctor should probably put you on what is called as prophylactic treatment. ಅಂದ್ರೆ ದಿನಾಗ್ಲೂ ತಲೆನೋವು ಬರ್ದೇ ಇರೋಂಗೆ ಒಂದು ಮಾತ್ರೆ ತಗೊಂಡ್ರೆ you will avoid medication overuse headache. Because you also have migraine, you have overused, abused painkillers, you come to the doctor. So the waters are all muddied now. We don't know if it is migraine or medication overuse headache, and it becomes difficult to diagnose. So any headache more than 3 months or any of the red flags and the danger signs istottu matadalla, I think it is better to see a specialist.
Yes. I think we have covered a wide range of topics from ಯಾವ ರೀಸನ್ ಹೆಡೇಕ್ ಆಗುತ್ತೆ, ಪ್ರೈಮರಿ ಹೆಡೇಕ್, ಸೆಕೆಂಡರಿ ಹೆಡೇಕ್, ಡಿಫ್ರೆಂಟ್ ಪೇನ್ ಜನರೇಟರ್ಸ್, ಹೌ ಟು ಡಯಾಗ್ನೋಸ್, ಮ್ಯಾನೇಜ್ ಹೇಗೆ ಮಾಡೋದು, ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜಸ್ ಏನು ಮಾಡೋದು, and we also discussed a few cases which you had encountered. So just to put everything together, I think headache is there can be multiple reasons. Could you put in a few sentences, how would you summarize what a patient should take away from our talk, from our discussion? Maybe a few points, maybe 3 to 5 points, maybe.
Yeah, definitely. See, headache is extremely common, and ನಾನು ಹೇಳ್ದಂಗೆ ಮೋಸ್ಟ್ ನಿಮ್ಗೆ ಯಾರಿಗೂ ಡಾಕ್ಟರ್ ನೋಡೋ ಅವಶ್ಯಕತೆ ಬರಲ್ಲ. ಪ್ಯಾರಾಸೆಟಮಾಲೋ ಅಥವಾ ಕ್ರೋಸಿನ್ ತಗೊಂಡ್ರೆ ಕಡಿಮೆ ಆಗುತ್ತೆ. If you have a feeling that ಇಲ್ಲ ಇದು ಯಾಕೋ ಜಾಸ್ತಿ ಆಗ್ತಾ ಇದೆ, it is getting out of control, it is better to see a specialist. One, you don't have to live in fear or in doubt of getting to know something by going to a doctor. The worst thing that could happen is that you could be reassured that there is nothing wrong. So don't worry, see a specialist and follow their advice. What happens is people are now afraid of taking tablets. I don't understand sometimes why. But it is better to take tablets if it was going to give you a good quality of life, get the pain down, and your ability to lead a healthy life. And ಇಷ್ಟೊತ್ತು ಮಾತಾಡ್ದಂಗೆ ಮಾತ್ರೆ ನುಂಗೋದು ಒಂದೇ ದಾರಿ ಅಲ್ಲ, ಅದು ಓನ್ಲಿ 30-40% ಕೆಲಸ ಅದರದೇ. ಅಟ್ಲೀಸ್ಟ್ ದ ನೆಕ್ಸ್ಟ್ 30-40% ಈಸ್ ಇನ್ ಅವರ್ ಸೆಲ್ಸ್, ವೇರ್ ವಿ ಇಂಪ್ರೂವ್ ಅವರ್ ಲೈಫ್ ಸ್ಟೈಲ್. ಹೇಳಿದ್ರಲ್ಲ ಡಾಕ್ಟರ್ ವಿಕ್ರಮ್, ಯಾವ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋದ್ರು ಅದೇ ಹೇಳ್ತಾರೆ, ಟೈಮ್ ತಿನ್ನಿ, ಆರಾಮಾಗಿ 6 to 8 hours ನಿದ್ದೆ ಮಾಡಿ, ಚೆನ್ನಾಗಿ ನೀರು ಕುಡೀರಿ, ಅಂಡ್ ಫಿಸಿಕಲ್ ಎಕ್ಸರ್ಸೈಸ್, ಅಟ್ಲೀಸ್ಟ್ half an hour of physical exercise 5 times a week is a must to sort of overall manage not only headache but our health well.
Wonderful. It was great talking to you, Dr. Sindhira. I think we have no other questions from the audience. Yeah. If anybody want to ask any questions to Dr. Sindhira, please put it in our Facebook chat, and we will definitely reach out to him and get the answers. He's available on appointment at Optima. If anybody has, yeah. Well, there's one more question. I think last question, we will take it. How long does the pain last when it occurs? I think most head, yeah.
I think what they're referring to is probably migraine. See, it differs. Cluster headache ಅಂತ ಇಷ್ಟೊತ್ತು ಹೇಳಿದ್ರೆ ಟೈಮ್ ಬರುತ್ತೆ ಅಂತ, it does not last beyond 1 or 2 hours, whereas migraine headache can last up to 3 days, whereas this trigeminal neuralgia, it only lasts for a few seconds. So ಎಷ್ಟು ಹೊತ್ತಿರುತ್ತೆ ಅನ್ನೋದು is also a way of us diagnosing which headache we are dealing with. So it ranges from a few seconds to a few hours or a few days. So it depends on what headache we are talking. Most commonly migraine, it can last up to 72 hours.
Yes. Thank you, Dr. Sindhira, for being very patient and answering all the questions patiently. I'm sure the audience will be better informed and would better understand the headaches and when to reach out to a doctor and what all management can be done, lifestyle changes need to be done. With this, we'll conclude this session. Thank you all for joining us. Thank you once again, Dr. Sindhira, for joining us today. I hope you all enjoyed it. Good night. Take care.
Thank you. Bye. Good night.
Bye. Bye.